Introduction. The landscape of legalized recreational marijuana for human use in the United States has led to a parallel increase in cases of canine marijuana toxicosis. While most dogs exhibit mild clinical signs and recover well with supportive care, some remain ataxic, unable to walk, or heavily sedated at the time of discharge. This study explores the hypothesis that flumazenil, a drug known to reverse the effects of certain sedatives, could improve consciousness, brainstem reflexes, gait, and stance in dogs suffering from marijuana toxicosis. The primary psychoactive compound in marijuana, tetrahydrocannabinol or THC, acts on cannabinoid receptors in the brain and nervous system. Dogs have more of these receptors in their brains than humans, potentially explaining their increased sensitivity to marijuana products. The endocannabinoid system, which includes compounds like anandamide and 2-arachidonylglycerol, plays a broad role in regulating neurological, immune, and inflammatory functions. It is also known that 2-arachidonylglycerol might have a binding site with the gamma-aminobutyric acid type A or GABA receptor, which is involved in sedation. Flumazenil works by antagonizing the benzodiazepine binding site on GABA receptors. In humans, flumazenil is used to reverse the effects of various central nervous system depressants, including hypnotics and alcohol. There is a knowledge gap regarding whether flumazenil can be a useful tool in the management of THC intoxication in dogs. Study design. This study was a prospective pilot study involving 17 dogs that presented to a private veterinary referral hospital with suspected or confirmed marijuana toxicosis. The study was approved by an Animal Care and Use Committee. 2 scoring systems were employed to assess the dog's conditions: the Modified Glasgow Coma Scale, or MGCS, and a novel scoring system called the Canine Marijuana Severity Score, or CMSS. The CMSS was adapted from both the MGCS and the scale for the assessment and rating of ataxia. Veterinary staff, including technicians and veterinarians, were trained to use both scoring systems. The dogs included in the study had a variety of breeds, ages, and weights, with toy breeds being common. Baseline scores for the MGCS and CMSS were recorded at presentation, and then 0.01 mg per kilogram of flumazenil was administered intravenously. The MGCS and CMSS were reassessed at 5, 15, and 30 minutes after flumazenil administration. During the monitoring period, heart rate, urine dribbling, hyperesthesia, vocalization, and vomiting were recorded. Blood samples were collected for serum analysis of delta-9 THC using ultra-performance liquid chromatography. The collected serum samples were stored at -20 degrees Celsius initially, and then at -80 degrees Celsius after a freezer upgrade. Samples were shipped together for batch analysis after 12 months. The statistical analysis included assessing data normality using QQ plots and Shapiro-Wilk tests. As the data did not meet normality, even after log transformations, nonparametric tests were used for analysis. Changes in the MGCS and CMSS from baseline to 30 minutes after flumazenil administration were evaluated using Friedman tests. The change in median CMSS was analyzed between several time points using Dunn's multiple comparison tests. Serum THC concentrations were grouped into ranges, and their relationship to baseline CMSS was analyzed using a Kruskal-Wallis test. Patient weights were also compared between the THC concentration ranges using the Kruskal-Wallis test. A p-value less than 0.05 was considered statistically significant. Results. Of the 17 dogs enrolled, 4 had confirmed marijuana exposure, while the other 13 were suspected exposures based on history and physical examination. The most common clinical signs included ataxia, hyperesthesia, urine dribbling, and cranial nerve deficits. A notable proportion of patients were hyperthermic and tachycardic. Only 2 of the 17 patients required inpatient treatment, the rest were managed as outpatients. The data showed that there was a statistically significant change in both MGCS and CMSS following flumazenil administration. The median MGCS at baseline was 16, and it reached 17 at 30 minutes post-flumazenil administration. The median CMSS increased from 17 at baseline to 19 at 30 minutes. As indicated in Figure 1, there is a statistically significant change in the Modified Glasgow Coma Scale or MGCS following flumazenil administration, increasing from a median of 16 with a range of 9 to 17 at baseline to a median of 17 with a range of 13 to 18 at the 30-minute mark. Figure 2 illustrates the changes in the Canine Marijuana Severity Score, or CMSS, with a statistically significant increase from a median of 17 with a range of 10 to 19 at baseline to a median of 19 with a range of 14 to 22 at the 30-minute mark. The statistical analysis, as shown in Table 2, indicated a significant difference in the CMSS from 0 minutes compared to 30 minutes, but there was no statistically significant difference between 0 and 5 minutes, 0 and 15 minutes, 5 and 15 minutes, 5 and 30 minutes, or 15 and 30 minutes. Detectable concentrations of THC were found in 16 out of 17 dogs, with an average serum THC concentration of approximately 215 nanograms per milliliter. There was a significant inverse relationship between the concentration of serum THC and baseline CMSS. Dogs with higher THC concentrations tended to have lower CMSS scores, indicating more severe clinical signs. However, there were no significant differences in patient weights across the different THC concentration ranges. 4 out of the 17 dogs showed no change in their CMSS 30 minutes after flumazenil administration. In one of these dogs, neurological issues were diagnosed as meningoencephalitis following the detection of THC in their serum and subsequent MRI and cerebral spinal fluid analysis. 1 dog vomited and 2 vocalized during the monitoring period, but there were no other significant adverse effects recorded. 1 dog with a history of seizures did not experience any seizures during or after the monitoring period. Table 1 shows the frequency of clinical signs and physical examination findings. Ataxia was seen in 71% of the dogs, hyperesthesia in 65%, urine dribbling in 53%, and cranial nerve deficits in 59%. Delayed pupillary light reflex, or PLR, was seen in 59% of the dogs. Table 3 shows a comparison of the baseline CMSS and serum THC concentration with patients having a median score of 18 in the 0 to 100 nanogram per milliliter range, 16.5 for the 100 to 200 nanogram per milliliter range, and 11.5 for the over 200 nanogram per milliliter range. Discussion. The study's primary objective was to assess the effectiveness of flumazenil as an adjunctive treatment for dogs with symptomatic marijuana toxicosis. The results showed that flumazenil administration is associated with improved MGCS and CMSS scores within 30 minutes, which suggests that there was a reduction in the severity of neurological signs. The CMSS is presented as a novel clinical scoring system that has the potential to be an effective indicator of clinical severity in affected dogs. The study indicates that the MGCS may be less sensitive than the CMSS for assessing marijuana toxicosis in dogs, because the MGCS does not evaluate ataxia, which was frequently observed in the study group. Although statistical improvements in both scores were observed at the 30-minute mark, there was no statistically significant change at the 5 or 15-minute marks following flumazenil administration. The study suggests that it is possible that a higher dose or a second dose of flumazenil could result in a faster clinical response. The study indicates that given the 30-hour half-life of THC, the clinically observable improvements observed were likely associated with flumazenil administration rather than spontaneous recovery. The frequency of cranial nerve deficits, particularly delayed pupillary light reflex, was higher than previously reported in other studies, which may be associated with higher THC concentrations in the study group. There is also the possibility of inter-observer variability in the assessment of cranial nerve function. One case in the study also involved a diagnosis of both marijuana toxicosis and meningoencephalitis. There is a potential association between THC and the onset of necrotizing encephalitis in humans, and the study suggests that THC's immunomodulatory effects could lead to a pro-inflammatory state in dogs. The study addressed the potential side effects of flumazenil, which included seizures and cardiac arrhythmias, but that these are mostly associated with higher doses and other factors, like multiple drug ingestion and history of benzodiazepine use. Although one dog vomited during the study indicated this may be due to marijuana ingestion. The dog with a history of seizures on phenobarbital and CBD had no seizure activity reported during monitoring, but the small cohort limited the ability to determine whether flumazenil increases the risk of seizures. The study also pointed out that if a dog has a seizure after flumazenil administration, benzodiazepines might be less effective in stopping it. The study's finding that dogs with higher THC concentrations had lower CMSS scores at baseline indicates that more severe cases may involve higher THC levels, though it is also affected by different times of presentation post-exposure. The study also noted that the storage temperature difference of serum samples was unlikely to impact the results, given a study on THC levels in resin-based marijuana products. One patient had the highest THC concentration and the lowest CMSS, suggesting that the CMSS was accurately capturing the severity of the case. There were only 3 patients with very low CMSS scores, and although they had a positive response to flumazenil, 2 of them had baseline gait assessment scores of 0 due to the severity of their impairment, which impacted their total CMSS. The limitations of the study include the absence of a control group, small sample size, different assessors for the scoring, different storage conditions for samples, and a lack of moderate to severe marijuana toxicosis patients. The study concluded that flumazenil could be considered as an adjunctive treatment for marijuana toxicosis based on its observed ability to improve neurological symptoms within 30 minutes of administration. The CMSS was seen to be effective in identifying dogs with higher THC concentrations and more severe symptoms. Lastly, the study reported on a unique case of a dog with concurrent marijuana toxicosis and meningoencephalitis. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.